Good afternoon. Welcome to the EMA office for our daily briefing on this lovely Saturday afternoon, where I'm joined by Chairman Mark Kern, and today Brian Whitaker, the Assistant Director of EMA, will be giving us our numbers today. Brian?
Thank you. Here in St. Clair County, we've tested 68,935, which is an increase of 1,495. Of those, 6,231 positive tests were received, which is an increase since yesterday of 64 new positives, and those are males and females under the age of 10 through their 80s. Our daily county positivity rate today is 4.3%. Negative tests were at 62,704. Unfortunately, today we are announcing an additional death that brings our total to 176. This death was a male in his 70s, and he did have underlying health conditions. Our thoughts and prayers go out to his family and friends that are affected by his loss. For those that have completed their IDPH required 10-day isolation period, we're at 5,373. For state totals, they've tested 4,371,876. Positive, they've had 248,177, which is an increase of 2,806 since yesterday. And unfortunately, the state is announcing 23 new deaths today, bringing the state death total to 8,166. For those hospitalized here in St. Clair County, we have seen, unfortunately, another increase since yesterday. We are now at 56 COVID-related patients in St. Clair County, with 2 of those patients on ventilators. And in the region, we've seen a larger increase to 123 patients in the hospital, and 10 of those on ventilators. For our congregate living centers in St. Clair County, in outbreak status, and that is 2 or more staff or residents that are COVID-19 positive or have COVID-related symptoms. We are announcing 1 additional case at the Aperion Care Center in Mascoutah, and 1 additional case at the Lebanon Care Center in Lebanon. Chairman?
Thank you, Brian. Good job. Sam will be back tomorrow.
Yeah.
Oh well, I guess we'll get her back.
Yeah,
but
we'll get her back in here tomorrow.
all right, we'll move into the zip code report. In 62059, we stayed the same again today at 11. 62201 goes up 2 to 226. 62203 goes up 1 to 186. 62204 stays the same at 128. 62205 goes up 1 to 189. 62206 goes up 5 to 419. 62207 goes up 1 to 232. 62208 goes up 7 today to 381. 62220 goes up 1 today to 484. 62221 goes up 6 to 584. 62223 goes up 7 to 357. 62225 remains the same at 27. 62226 goes up 10 to 651. 62232 goes up 4 to 171. 62239 goes up 1 to 86. 62240 stays the same at 31. 62243 stays the same at 87. And 62254 goes up 6 to 218. 62255 remains the same at 16. 62257 goes up 1 to 33. And 62258 goes up 3 to 159. 62260 stays the same at 113. 62264 goes up 2 to 87. 62269 goes up 5 to 492. And 62282 remains the same at 8. 62285 went up 2 today to 72. And 62289 stays the same at 6. Our regional positivity rate is 9.4% today, according to the state's numbers. But the numbers that we keep every day, that we calculate at 2 o'clock, we peg our county positivity number at 4.3%. But Herb, I think it's important when we look at those regional COVID patients, 123 of them today, we got to remember to thank the doctors, the nurses, the medical staffs at these hospitals. We haven't seen numbers like this for a while. So all our first responders, our dispatchers, the entire medical community, anyone who's out there working with COVID patients, their workload's going way up. And that's a time when the stress levels rise and when we need to remember to thank those individuals that we know that are out there putting their lives on the line.
Well, and that's why since day one we've said that our first responders and the medical staffs and the physicians, this is a time that they all have to work together. From the time that 911 call comes in to our telecommunicators, we have a system set in place to where the COVID patients, our first responders are aware, and they can take the proper precautions with the PPEs. And then by the time they get to the hospital, the ER staff is made aware. So it's a well-oiled machine when it comes to our first responders working together for the best of the patients. And
that policy, so we've been doing this I don't know how many days now. That was one of the first policies that Illinois Department of Health was not allowing to start with.
Right.
That notifying of the first responders of a house where a COVID positive person was, and it was this EMA that went to them and said, we need to start reporting these. You need to allow us to do it, and it was through the communications with our state representatives, who all helped out and all agreed with it that happened.
Well, and it's the thing is,
and state senators.
And state, yeah, and we don't disclose patients' names or anything like that, but it's a way that we have to let our first responders know who are out there doing their job, of course. But again, we want them to do their job safely, and they have to have that information available for them to know what other extra precautions to take. And we did do that, and then several of the other counties have followed suit across the state with doing that. So again, first responders are part of Team St. Clair, and we appreciate every one of the physicians that we've had on here, the nurses, all the medical experts that's come on. We couldn't get it without you. These numbers, as you talk, Chairman, we crunch them every day. We scratch our hair, pull our hair out, wondering about them. The regional positivity rate went up to 9.4 from yesterday. Today, our concern is those hospitalizations is another metric that we really have to keep our eye on. So we're watching all of them. Tomorrow is our question and answer session, so there will be a portal that you can ask your questions, and we'll try to get them answered tomorrow for you. We did get a lot of feedback on the briefing yesterday about the little video that we played. Some people just thought it was great that young group of individuals, our futures, put that together to kind of show their support for Team St. Clair and what it means to them. So before we leave today, we're going to replay that little encore of them giving their message out about wearing the mask, wash your hands, and watch your social distancing as we approach this Labor Day weekend. And we want everybody to remember what these young ladies, the message that they're sending to us, because we're all in this together, Team St. Clair, and we'll get through this. So take a look at this, and we'll be back with Daisy in just a few minutes to translate this into our Spanish communities, and we'll be here tomorrow afternoon for the next briefing. Thank you.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Scrubs, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock